Hey guys, welcome back. This is Dr. Saumil Shah. Today we'll be speaking on what is the post-operative care and how is the recovery after tummy tuck surgery. Once you guys have decided that we want a tummy tuck surgery done, what is the care that you need to take before the day of your surgery? You will have to, first of all, if you're a smoker, stop smoking for at least a month before the surgery and at least a month, preferably 3 months after the surgery. And if it helps you quit smoking, that's a bonus. This is very important because if you smoke, the chances of there being what is called a skin necrosis, that is the skin becoming black and it's losing its blood supply, is very high, and this is one of the very undesirable complications after a tummy tuck surgery because it makes the scar look much uglier than what it can look. The second thing you will need to do is, if you have any other health problems such as high blood pressure, diabetes, thyroid problems and anything else, you'll need to continue these medications, get these things under absolute control, and then and only then can the tummy tuck surgery happen. Another thing again is, if you're on any kind of blood thinners, you'll need to stop that. As well is that if there is an issue where things like vitamin E, you are taking a lot of supplements such as vitamin E, fish oils and other types of supplements, a lot of spices in your food, it always helps to decrease this before the surgery because they also cause increase in what is called as bruising after the surgery, which is basically the blood collecting underneath your skin. So these are the major things, and the most important thing is discuss with your plastic surgeon as to what exactly you are looking for, what exactly the after the surgery, the look that you are approximately about to get, and whether you will be okay with that or not, because this is the most important thing about the surgery. Your expectation has to align with what the surgeon is trying to do. Coming to the day of the surgery, usually unlike liposuction, here when we tighten your muscles, we would want you to stay for one night overnight in the hospital and get used to that tight feeling, a little bit of pain, and also the surgery lasts a little longer, and so we want you to stay in the hospital for one night overnight. This is of course preferable. However, in some circumstances we can let you go home on the same day, but that needs to be discussed with your plastic surgeon during the consultation. Now on the day of the surgery or just after the surgery, you will usually be having a good amount of analgesics or what is called as painkillers in the hospital. In our setup, we also usually give what is called as an epidural injection during the surgery, so that the pain while you are in the hospital is very minimal. We can also do, in our setup, what we also do is on the day of the surgery, the anesthesia is like a no injection anesthesia, basically, where we give you all the anesthesia after we give you a inhalational agent. So that is regarding the day of the surgery. So now coming to the care that you will need to take after the surgery once you are discharged from the hospital and you go home. There are a few things that you need to do or you need to understand and prepare for from before the surgery. You will need one person to take care of you and help you out with your daily chores such as going to the bathroom, getting up and all these things, and just walking around will be a little bit painful and a little bit uncomfortable for the first 2 or 3 days at least. The pain, the swelling and the tightness decreases to a great extent over the first week. Every day you will feel that it's become much better, and say by the end of about 10 days to 2 weeks you will feel much better after it. The pain is not very much. What you will feel more is discomfort and tightness, because we have removed the skin and tightened the skin. We have tightened your muscle, and this is what you need to get used to. It is very normal to feel this discomfort, and it is something that your body just has to get used to. Over time, the skin and the muscles and everything relaxes, and you won't feel this, say, after about a month and a half. Usually from the hospital you will need someone to drive you home. You can't drive back home on your own. About starting work, if you have a desk job, I would say you can start work in about a week to a 10 days time. If it is work from home, definitely in a week's time or even in 5 days time you can start. Depends on your pain threshold. If you are into field work and you have to travel for work, I would say you need to give about 3 weeks before you can actually do proper field work where you'll be able to go out and do all your normal things. After the surgery, you will be given oral medications. These will be antibiotics to prevent any infections, medications to decrease your pain, which are basically painkillers, antacids, and some medications to decrease your swelling. These need to be taken from anywhere between 5 days to a week. They are oral medicines. They absolutely need to be taken. We'll need you to come down to the hospital on the 3rd day and the 7th day after the surgery for doing the dressings, and then maybe at say 2 weeks, 1 month, 3 months and a year, we need just follow up from you to know if there's any issues, to take photographs and to understand how your results are progressing. Now, as in liposuction, because liposuction is a part of tummy tuck, but similarly you need to do 2 main things. One, which is use of pressure garments, and second is massaging. Now, pressure garments are basically things like a corset that keeps your skin adhered to the underlying tissue so that the swelling is not much, there is not much collection of fluid or blood. Another thing that we'll teach you is what is called as a lymphatic massage to remove any swelling, and this will be started after say maybe 5 days to a week once you're a little comfortable and the pain has gone down. Both of these things are very important to reduce the swelling, because the swelling is the thing that once it reduces, your skin will start getting back to normal and you will see your the final results or the recovery that is said to happen is what will happen. So guys, these are the main things that you have to take care before, during and after the tummy tuck surgery. Do let us know if there are any other questions. There will be some other differences that come up between patient to patient and between different surgeons as well if you get it done from someone else. So these are just the broad strokes about the care that needs to be taken after the surgery. If you still have more questions, you can definitely ask them during the consultations or you can give us a call. Hope to see you soon.